Hello, my name is Bailey Fitzgerald. On behalf of myself and Dr. Lee Krug, today I will present the video abstract for our review article on the treatment of unresectable malignant pleural mesothelioma in 2021, Emerging Standards in Immunotherapy. Patients with unresectable malignant pleural mesothelioma have historically poor outcomes, and treatment has been limited to palliative chemotherapy. Until recently, platinum-based chemotherapy with pemetrexed was the established standard first-line treatment for unresectable malignant pleural mesothelioma, based on the results of the phase 3 EMPhASIS trial. Less than half of the patients treated with cisplatin and pemetrexed had objective responses to treatment, and only 50% of the intervention arm survived to 1 year, demonstrating the continued need for improved or adjunctive therapy options. Outcomes for patients with non-epithelioid or sarcomatoid histology have been even more disappointing. Second-line therapy options were quite severely limited, without any chemotherapeutic agent able to offer substantial objective response rates. Recent efforts to improve prognosis for these patients by adding angiogenesis inhibitors to chemotherapy have led to significant benefit. In MAPS, a large phase 3 randomized controlled trial conducted by the French Thoracic Oncology Cooperative Group, the primary endpoint of median overall survival was significantly longer with the addition of bevacizumab to chemotherapy, with a hazard ratio of 0.77 favoring bevacizumab, improving the median overall survival to 18.8 months, greater than the control arm of 16.1 months, which, of note, was longer than in the cisplatin plus pemetrexed arm in the EMPhASIS trial. Encouraging data have also been reported with a VEGF monoclonal antibody and chemotherapy combination in the second-line setting. The phase 2 RAMES trial demonstrated a significant overall survival benefit with hazard ratio of 0.7 for gemcitabine plus ramucirumab versus chemo alone, and a median overall survival of 13.8 months. However, the emergence of immunotherapy combinations for frontline treatment has upended the standard of care and has led to the first new FDA approvals for the treatment of malignant pleural mesothelioma in nearly 2 decades. Combination nivolumab plus ipilimumab is rapidly becoming the international standard of care for eligible patients based on the results of the Checkpoint 743 phase 3 trial, incorporated in the NCCN guidelines with a Category 1 recommendation, and securing FDA approval late in 2020. Although dual checkpoint blockade outperformed chemotherapy in all randomized patients, with a median overall survival of 18.1 months versus 14.1 months, this effect was amplified in patients with non-epithelioid tumor histology, where median overall survival was 18.1 months versus only 8.8 months in the chemotherapy group. Options for the treatment of unresectable malignant pleural mesothelioma in both the frontline and subsequent line settings remain limited. However, the addition of robust data in the immunotherapy and supplemental anti-VEGF treatments to traditional chemotherapy have unquestionably changed the standard of care. Standard chemotherapy, chemotherapy plus bevacizumab, or nivolumab plus ipilimumab may all be considered as first-line treatments for unresectable malignant pleural mesothelioma. Future trials will be built on immunotherapy backbones. Efforts to increase efficacy by adding additional agents are highly anticipated. The phase 2 data for chemoimmunotherapy combinations has been exceptional and is already infiltrating clinical practice in select circumstances. Several ongoing trials are evaluating combination chemoimmunotherapy, including the DREAMER trial, examining platinum-based chemo plus durvalumab, a CCTG/NCI study evaluating platinum-based chemo plus pembrolizumab, and BEAT-MESO, examining platinum-based chemo in combination with bevacizumab and atezolizumab. And combinations with other novel agents are also being investigated. The field is continuing to change rapidly, and support for ambitious, large-scale, well-designed trials remains vital for defining the future outcomes for patients diagnosed with malignant pleural mesothelioma. This review offers an in-depth exploration of these practice-changing clinical trials in unresectable malignant pleural mesothelioma. We discuss the data for VEGF inhibitors and immunotherapy, which have led to paradigm shifts in the current standard of care, as well as overviews contextualizing trials that provide rationale for these past and ongoing studies. Ultimately, this paper strives to define current paradigms in the evidence-based treatment of unresectable malignant pleural mesothelioma with an outlook towards exciting ongoing investigations in the field. Thank you so much for your attention.